So let's get into it because there is something that's on my mind. Excellent article was done by Edgar Mendez, who is reports for the Milwaukee Neighborhood News Service. And one of the things he did, which I think is very important in this time of Corona COVID-19, is to check in on those essential workers and find out how are they making it through this difficulty of living through COVID-19, excuse me. So he wrote an article that says, I won't feel safer until this is all over, checking in on essential workers. And some of the comments I want to talk to you about and get your input on how to respond to that. As we know, children are going through a difficult process, a difficult transition in this particular situation. And a lot of them are struggling. And I just want to read a segment of what one of the young people had to say. The mom is making a statement. She said, at home, everything is still good. My oldest daughter and I are still the only ones going out. My 14 and 13-year-old gave up on their online schoolwork. It's like they're in a depression stage dealing with this quarantine. They really miss school. My 14-year-old starts high school in the fall and is worried about jumping from this to that and not finishing 8th grade. So do you have any advice to how to deal with that type of situation?
One of the things that I think is interesting about quarantine time, what COVID-19 has taught us, we were unprepared to support our children at this time. Children did not have a transition into online schooling, and so they have almost become overwhelmed with the amount of time that they are having to spend on the computer. You think about it, for many of us who work in the office setting, we are bombarded with emails all day long, right? You have to manage your email box, manage the amount of emails that are coming in, respond to them, get everything done. And so that can sometimes be difficult and overwhelming and cause anxiety for even the most well-functioning adult, right? You have to learn skills in order to manage being on a computer, responding to people all day. And so now our children are being asked to do that, and they don't, not all children, I'll say, possess the capacity to do that. And so what was once a fun incentive for children, getting on the computer, has now become a task. And so it's not fun. And then they don't, they're not able to have the breaks that they used to have of seeing their friends, spending time with their friends. And so I think that for parents who are experiencing this, really what we have to do is come up with a routine for your home and try to let the kids have something very similar to what they do at school. Do a couple subjects, have a little break, have a little snack break, have a little TV time, phone time, whatever that may be, but allow your kids to not sit at the computer for 8 hours straight to work. And ongoing, I think that the emergency preparedness plans that schools develop will really have to take into account what do we do for students during the time that there may be a pandemic and they have to work from home, and how do we not overwhelm the students with too much work?
Excellent answer. One of the other people that participated in the article works for Amazon, and she indicated that she didn't feel any safer than she did a month ago when they did the initial article. And what she also stated was it's a little scary going to work, having to be in a warehouse where a lot of people are touching cars and touching packages that other people are touching. Franklin Delano Roosevelt said, there's nothing to fear but fear itself, right? And then I was reading an article online that was talking about, this therapist was telling the person, well, you need to say to yourself, I'm not afraid. I'm not scared. I'm not this. And saying that you really are not afraid, you're not scared, and you're not. And I said to myself, is that really, and I'm not a therapist, I just said to myself, does that really make sense? Because I think sometimes those emotions are good emotions. I don't think that we should just dismiss them when we feel them, because then I think we're just deflecting.
I can understand that the clinician have wanted to take a certain approach, and it depends on the client and what issues you're addressing. Right now, I think that my clinical approach will be to validate the concerns that individuals are experiencing right now, because as you shared, the young lady who works for Amazon, I believe in that same article she shared that it's a luxury to go to work and be able to still socially be socially distant because of the work that they do. And that's a valid point, right? Is that you have competing priorities. You want to make sure that your family is safe. You want to make sure that you're able to take care of your family by going to work, being able to pay those bills. But you're also in fear that going to work, you could contract a virus that could be deadly to you or your family. And so reconciling that, I think, is important, but it's also important to validate that these are the concerns that I'm experiencing, and how can I advocate for myself with my employer, and how can I try to make things safer for myself and for my family. And so some families, some practices that I'm hearing is that if there is an essential worker, that individual sleeps in a separate room, right? So that they can be, but again, that may be a luxury as well, because we know that some individuals, they're not living in large households. They may be living in 1 or 2 bedroom homes. And so it may not be an option for them. And that adds to that fear. And, saying I'm not scared is not going to work for everyone, especially when people are truly, you don't want them to learn to hide their emotions, when really, similar to pain, it points to something's wrong right now.
And one of the things that I am concerned about, as we're still in New York, we're still sheltering in place, and we will be for a little while longer. We're looking at the frightening numbers, Dr. Brittany, in terms of the levels of alcoholism, they said, in terms of alcohol consumption, the levels of violence against children and women.
Mm-hmm.
And, one of the people reached out to me, one of my dear friends, who keeps telling me that we're not talking enough about the psychological aspects of COVID and,
Mm-hmm.
and its impact on the family. And I was wondering to myself, how do you resolve a situation like this? Because where do people that are in danger, people that are being abused, where are they to go?
A lot of shelters for women and children, and even men, homeless shelters, a lot of shelters are reevaluating their practices for accepting individuals. And so it's important that people reach out. Don't just assume that because COVID is going on, they are not taking people. Even here in the Tampa Bay area, they've just redone how they're accepting people. So they may require that you're in a room for 14 days or 7 days by yourself prior to putting you in a room with other people, which then, of course, that room is considered the quarantine room. And so it delays the intakes. But I want to address the point that you said, the gentleman shared with you, not focusing on that psychological impact. And I'd agree. Research has shown, and I may have shared this in a previous interview with you. So first responders can show signs and symptoms of PTSD up to 3 years following a pandemic, and they've researched the impact of these pandemics on individuals that have to isolate or quarantine from previous pandemics. We had the H1N1 and swine flu. So we have to use that research to help us support our communities. And I think that right now, because we've been in problem solving, because we've been in how can we get safer mode, we have allowed the mental health of individuals to kind of take a back seat. We're going to see that. We are going to have to deal with that at some point in time. And it makes sense that the substance use is going up. It makes sense that intimate partner violence, not just women but men, is going up. It makes sense that the abuse and neglect of children, those rates may be going up. We may see it currently because children are not visible in the community. We may not see it because people are safely sheltering. But as the community starts to open back up, we'll see the impact of individuals not being able to get out of the house, individuals not having space from each other, and unfortunately children suffering or maybe not having access to resources, services that have kept them safe for quite some time. So I do anticipate that for clinicians, individuals working in child welfare, law enforcement, court systems, we are going to see the impact for a few years, because unfortunately, this has not been easy for a lot of people.
Communities of color in Brooklyn, like in the Bronx and like in Brownsville, like my neighborhood, hot spots. And so there's been a push now to do a lot of COVID-19 testing, but there's also a pushback from people in the community that are angry about they want to test for antibodies now, but where were you when you needed you to start testing for the condition? A lot of people here couldn't get a test or whatever, yet our communities were impacted the most. And some people believe it's like a philosophy that this is going to be an aphid thing, whereas they're going to be testing in communities of color, finding that the majority of the people here have antibodies and want them to donate so that could treat everybody else. And a lot of people are angry about that. So I just wanted to talk to you about that. And then people have anxiety about getting involved with the government because of that feeling, the anger and the lack of response that has occurred.
Mm-hmm. I find it very interesting that in communities of color, churches have taken on multiple roles. And so what I'll say about that is that the church, being a faith-based organization, they do take on those social services. And so Salvation Army is a great faith-based organization, started as a church, and they do many of social services. And so I believe that the church can be successful in doing these things. And so I can understand why churches in minority communities take on We Will Help. And so, that one particular article where the churches are doing the testing and reaching out to local officials and saying, hey, we will help increase access to the communities of color by having testing occur at the church. My concern, though, is that the staffing capacity at many churches and the training and educational background of many people who are leading those churches is great, but it's not of medical or clinicians or full social service agencies. And so really, communities of color, what you see is, why do we still have a lack of access to actual medical care and social service agencies coming into those communities and setting up? It's one thing to say, we're going to take the hospital and we're going to set up here. And so in my area, they have set up testing sites at the local football stadium, right? So essentially, if you can put doctors and nurses there, you can partner with communities of colors and say, we're going to put doctors and nurses in the church if the church is willing to allow the building. And continue to do those things, but it still says, when can we get those buildings and that access in our actual communities? Because churches are not set up. Maybe mega churches are, but in rural areas, churches are not set up to do all that work alone, and they shouldn't be held responsible for doing